dragging our feet.
Thank you very much. Just want to talk about our young people that go in and have a lofty goal of becoming a doctor or a nurse or working in the health sector. Just for a moment, focus on that. Currently, I think around 300 odd students in Otago, 34 are in the rural program. What else could be done to ensure we have students who, when they graduate, go into our rural into our regions, so that we don't have a concentration, as we tend to have had in the past, going to bright lights of the big cities, so that we have a greater spread of those young people going out to the regions. What programs or funding or supports are you looking at? That's the first part of my question.
Well, I'll ask you to keep it quite tight because I want to get back over.
It's literally one question with 2 bits to it.
Yeah, no good
and the second
question.
part of that is we hear a headline that when our students graduate, they're heading off overseas. So if I could just have some detail around those international students, the Australian students that we train, doctors in New Zealand, are they the ones that are heading overseas or going home to Australia? Do they influence those numbers at all?
Look, I think so. Thank you for your question. I mean, firstly, we need to train more doctors. That's really important. Acknowledge, so last year we increased the number by 50 based on funding the previous government allocated in budget 23. And then increased it by 25 this year and increased it by 25 next year, meaning over the course of this government, 100 more doctor training places in our universities each and every year. And so that is incredibly important to provide more access. The point you're making around making sure that we are focusing on our rural communities is really important. And a big part of that is supporting doctors into primary care pathways. And that's where the focus of the NZ Rex pathway is important. The 50 domestic graduate doctors into primary care and supporting those pathways will play a role in helping to address that challenge. We also need to make sure that we are incentivising nurses to work in those rural communities. That's where the 400 graduate nurses annual support payment to primary care who take on graduate nurses annually for 5 years. There'll be a $15,000 payment if they're in an urban environment, $20,000 payment if they're in a rural environment. And so that's got to focus on rural communities as well. So a number of things we need to do, and we continue to work with Health New Zealand continues to work with general practice around how we can support those training pathways. Again, I bring back to the $95 million uplift for primary care, which is being going through the PSAP negotiations at the moment, by making sure that we are supporting financially primary care. We'll also support primary care to be able to then open up and create more jobs in those parts of the country as well, which is really important, and make sure that those jobs are attractive for doctors to go and work in.
Thank you. Aisha Primary.
Thank you, Mr. Chair. In February, Treasury advised that to achieve Health New Zealand's intended deficit of $200 million at the end of the financial year 25-26, they would need to cut nearly twice as much as was sought for the preceding financial year. Given cuts of that scale, do you admit you can't meet budget without cuts to frontline services?
There will be an investment increase in budget 2025, which will flow through to increased delivery within the budget. And we're very focused on delivering within budget. I'm happy to ask Pamela Balkett to speak to this, Head of the Health Insurance Unit.
Thank you, Minister. Through you, Mr. Chair. So Health New Zealand's forecast to run a $200 million deficit next year. So it will deliver more services than it's receiving revenue for. The Treasury advice was from before we'd been able to understand the Crown entity's financial performance, and it has considerably improved since then.
What is the value of the cuts required in the coming financial year to be able to achieve the $200 million deficit figure?
In the coming financial year?
In the one that we're discussing.
Yeah, so Health New Zealand is running a $200 million deficit, and the government will fund that deficit.
I understand that. Health New Zealand has run a savings or cuts or reprioritisation program, and will need to do so in order to meet that budget. What is the value of that program?
Supplementary.
I want to give the most
Mr. Chair,
to the opposition.
The answer to the question is Health New Zealand will run a $200 million deficit,
Right.
and the government will fund that deficit.
This is Parliament. You're meant to be able to be accountable to Parliament for public money. This is an outrage that you're not saying how much you're going to cut from the health system.
There will not be, we are investing more than we invested in this financial year, and we will be investing in more services to deliver for New Zealanders. That is what we are delivering. And the question you're asking has been answered. There will be the Health New Zealand has a deficit track. It will be delivering within that. And my expectation is it delivers on the 5 health targets for New Zealanders and delivers those services within its budget.
Supplementary. When Treasury estimated that $1.37 billion was required for cost pressures in the health system in the financial year 25, pay equity contingencies sat outside the health system. Now the government requires 13 pay equity claims to be settled from within health baselines. Why didn't you increase the $1.3 billion figure so that you can pay those pay equity payments?
Well, as we've said on multiple occasions, pay equity is here to stay. It's law, and there is a contingency which has been set aside within, I think the Minister of Finance has said this on multiple occasions, there's a contingency that's been set aside for public sector pay equity claims, and that will be dealt with on a case-by-case basis.
There's not one more dollar for underpaid women in the health budget.
We have, as I said, the government has set aside a contingency for public sector pay equity claims. The Minister of Finance has said that.
2 more,
And
Mr. Chair.
it's exactly as it was before. There was a contingency set aside. There remains a contingency set aside.
Got one from Carlos and then.
Please, I got a
Two more and then
supplementary
I'm
question. So,
To you.
Minister, if we don't actually prioritize our spending or adjust the financial deficits, in your point of view, what's happened to our healthcare system?
Well, we're very focused on delivering within the budget. That's the focus that we have, is we have a budget and we will deliver within that budget. And I note that the former
The focus
Minister
is
of Health,
they'll
Dr. Aisha
deliver.
Durrell, sent a very similar letter to the then Chair of Health New Zealand, requiring them to deliver within the budget. So that is nothing new.
Oh, they're
It is
going to
the approach that
deliver
we're
in the
taking, but I
budget.
am bringing a very strong emphasis on the word deliver, because patients expect delivery, and I'm very focused on delivering.
Thank you. Back to Dr. Errol for your two stuff. And then for the rest of the question.
I
They're
mean,
focusing on delivering, guys.
I mean, the problem is like, don't we expect the beneficiary who we're not giving the money for petrol to get to the appointment to deliver themselves to the appointment?
Have I
We're not going
emphasized
to
the word
provide
deliver?
funding for them to have petrol to turn up to their mandatory seminars that we're going to sanction if they don't turn up. We just expect them to turn up and deliver the results of turning up.
He's so cute when he's trying.
Oh boy,
Ooh.
yeah, that rule. Oh man, I was Jenny Marcroft again, asking another really good question. I thought the nurses were going to get that 50K. Turns out they're not. The business that they're working for is going to get the 50K.
Yeah,
Oh
you know what
shit!
now?
They don't even get the money to go work in a rural community.
You know what's the worst thing is going to be if he doesn't deliver and they go over budget.
Yeah.
Yeah, well, I mean, like they're going to say, yeah, we haven't got
Considering that
enough
was
money
his one goal.
we're in deficit and we haven't got enough, but we haven't got enough revenue coming in. It's like, okay,
Oh, we are
so
so
we're going to
fucked.
go into deficit and the government's going to top us up.
Yeah, it's like, oh, we'll just train more doctors. Okay, where we're going to put the doctors? Oh, no, we're making all these cuts, to things like ACC and stuff. They'll have to go into private care. Oh, great. Yeah, okay. Very cool. If they go into private care, the business gets, I don't know, 50K per nurse. Fucking hell. So you're not even rewarding the people for going into care. You're just rewarding the business owners.
Yeah. Well, isn't that like what was it called? Didn't they during the COVID years? They didn't want the strings attached. That you had to actually not sack the staff members to get the wage subsidy.
I'll have
And
to look
National
deeper
would-
into that, but
Yeah, but National were not actually keen on that particular clause being in there, and they weren't exactly keen about the database.
yeah, I mean, the other question that Jenny also asked, which was a good question, is do international students stay here or do they go home? Did he even answer that question?
Historically speaking, if they were doctors, they typically did end up staying because they ended up with their qualifications in New Zealand. As you probably remember from Sunday night's show that we talked about was the surgeon that I think you and I both had at different points, Beryl, from Korea, trained at Otago and later on at Hut.
Yep.
I doubt that she's going to go back to South Korea. I'm very certain she's staying in New Zealand. Might go to Australia, but, isn't going back to South Korea.
Because, one of my friends is from Russia. He is a doctor. He's a radiologist. He can't get work here in New Zealand. So he's planning on going to Australia.
Yeah, but they're training more doctors.
Yeah, but they're training more doctors. Okay. Yeah, never mind the doctor that's just come over from Russia who's already qualified for the job. Can't have him.
Yeah,
And he re-qualified. He got a different qualification here in New Zealand. So he got more qualifications, still can't get a job.
Yeah. Oh, like my friend Marion Layton, who used to sit there and fill in for Gary at was it Whangarei? now can't fill in for work in New Zealand, so she's off to Australia for 6 months a year.
Yep. That's what cats do for you.
Yeah.
If they fund the private sector, it will fund jobs. It will create jobs. Everyone knows that.
Oh yeah, yeah. That's historically always been the case.
Exactly.
We just give the rich people more money. That always
They don't
works.
sink it into things like lobbying and paying nationals so they can keep their money.
Yeah,
They wouldn't waste money on
they
that,
don't
would
spend
they?
their time advocating for lesser environmental protections or less workers' rights.
No,
We love it.
no, they put that into jobs. Yeah, everyone knows.
And that's why when you sit down there and you lower prices, have bigger profits, you put that into staff. Even that profit comes after expenses in the profit and loss statement.
Yeah, every business owner I've ever met goes, I can't wait to hire more staff and pay more staff. It's just like it's an itch they're ready to scratch. They love it.